My name is Justin Gainor. I'm the program director for the Center for Thoracic Cancers at the Massachusetts General Hospital. I'm a thoracic medical oncologist, as well as an associate professor of medicine at Harvard Medical School. And my research interests have been as a clinical and translational researcher focused on developing targeted therapies for fusion-driven cancers, as well as developing novel cancer immunotherapies. ADC refers to antibody drug conjugates. And so the way I think about antibody drug conjugates, this is a class of drugs. It's meant to be a more directed way of giving chemotherapy. So we think of three distinct components of an antibody drug conjugate. There's the antibody itself. And think of antibodies as they stick to things on the surface of cells. And so you can engineer antibodies to attach to a variety of different things on the surface of cells, ranging from some common targets like HER2 or TROP2, HER3. These are all names of receptors that are commonly expressed on the surface of tumor cells. The ideal antibody targets are targets that are preferentially expressed on the surface of cancer cells, but are not present on normal cells, right? You want to have some differential there. So the antibody is one part of an ADC. The second part is what we call the linker. It's basically something that bridges both the antibody and attaches it to the third part, which is the payload. That is typically a toxic chemotherapy that usually we couldn't deliver on its own. But given as an antibody drug conjugate, we're trying to bring that directly to the tumor. And the way I describe this in the clinic is it relies on this Trojan horse type of principle. That is, the antibody kind of docks to the surface of the tumor cell. It gets internalized, and within the distinct environment within the tumor cell, that linker dissolves and releases the chemotherapy within the tumor cell. So that's the idea and the principles behind ADCs. There are many different ADCs that are currently in clinical trials against a variety of different targets. And so I think these are really exciting ways of treating cancer. And I think we're going to see more and more of these antibody drug conjugates approved in lung cancer. We suspect that the initial approvals are going to be in a different subtype of lung cancer, EGFR mutant lung cancer. But as we've learned over the years, is that once we see success in one genomic subset of lung cancer, it rapidly gets translated to others. And so I do anticipate that we're going to see broader approvals of other antibody drug conjugates. And the hope is that will also provide a great deal of benefit for patients with RET fusion positive lung cancer.